Hi, it's me again, Dr. Kate Gifford, and I'm here to conclude the foundation stream of our Myopia Action Month online seminar series with topic number 4, which is using resources to support you in practice. Now, what I'm really going to focus on is all of the resources available to you on myopiaprofile.com, and almost all of these are freely available. So this is really designed to help you navigate through these elements of what are available to you on the website. Okay, so let me tell you all about it. Now, Myopia Profile really started with clinical articles. So answering clinical questions from a scientific basis. And this is where you can find answers to important questions that trouble you in clinical practice, understand what the evidence tells us in terms of how management should occur. We also have our science summaries, which are generally single articles, which are summarized, including what we still need to learn and what this means for your practice. If we are following through the Knowledge Center, which is that first tab at the top of myopiaprofile.com, what you'll also come to, which we launched last year, was the world first myopia control product compendium. And this is where you can really go to find information on specific products, science articles, clinical articles, all of the information you need, basic parameter information and links to manufacturers as well. Next along on the tabs at the top of myopiaprofile.com are our courses. We have a variety of courses available, and just recently we have launched a bunch of new courses, which I'll tell you about later, and bundled them into foundations, advanced, and comprehensive training. So there's different levels of knowledge and of depth in these courses available to you. And then next along on the tabs is resources. Now, resources are what I'm going to focus on for the next few slides, because this is really designed not just to educate you on myopia management, but also to give you tools to have these conversations in practice and to be able to understand what this looks like in a clinical setting. Now, in that screenshot there, you can see we've got our Managing Myopia Guidelines infographics, which I'll talk through over the next few slides. We have our patient brochure as well, which is the take-home accompaniment to the infographic. We also have an informed consent template, which you can download and chop and change the text from as you wish to use on websites or to use on your own informed consent form within your practice. We have a contact lenses for kids infographic, which was a joint project where we undertook with Johnson & Johnson. And we also have the My Kids Vision QR code sheet. And that's a really important one for directing parents to specific articles on mykidsvision.org, which is our public awareness facing website, the companion to myopiaprofile.com. So next I'll focus on the myopia management guidelines infographics, because these have really been designed from the ground up to guide you through a clinical communication process in myopia management. That's the first side, the colourful side you can see there on the left. And then secondly, to provide a chairside reference for you. Now, using these in my practice, over the many iterations we've had over time, I've had parents go, "This is fantastic," and put their phone and their car keys on top of the infographic and try and take it away with them. That's what we have the parent brochure for. So this is designed to print out once on good sort of quality card, so you can keep this as a reference in your practice. And just this year we have released up to our 20th language translation of the infographics, thanks to generous colleagues from around the world who have assisted in verifying our translations. So the first side, the colourful side of the infographics, is designed to guide you through a parent communication process. And I will show you each of these panels in turn. Firstly, we start by talking about visual environment, because this is important advice for all kids with myopia or at risk of myopia, and arguably all kids, as parents will be seeking this information about screen time particularly. Then the second panel is talking about the options available for myopia management. The third panel is why kids can wear contact lenses if that's something you're looking at prescribing for that particular child. And then finally, why myopia management is essential and what our short-term and long-term goals are in myopia management. So our very first place to start our discussion in myopia management, if we're thinking about that overview of everything we may want to cover in a framework of clinical discussion, is visual environment advice. And this is useful advice for all kids, as I said earlier, not just kids who are myopic or at risk of myopia, but obviously extremely important for them. We've got very clear information here and clear rules, if you want to put it that way, for parents. And that's talking about outdoor time, and then along the bottom, particular goals for indoor time, screen work, and near time. So that's maintaining a reasonable working distance with the elbow rule, keeping an elbow to forearm distance away from reading material. The 20-20 rule, to take a break every 20 minutes to 20 seconds, and the 2-hour rule, where we are attempting to limit leisure screen time outside of school hours to less than 2 hours per day. Our second panel goes through myopia management options, and in my previous lecture on understanding efficacy, we went into these podiums in more detail. But ultimately what this enables us to do and to easily visualize is that there are multiple treatments available. Not all treatments are available in all countries, so you'll be making a decision on what to prescribe based on what's available to you and what's suitable for that patient. And this is an easy way for parents to understand efficacy from the point of view that we can't stop myopia progression, but we can slow it down, and we can slow it down by quite significant amounts based on our best available treatments. Now, our third panel on why kids can wear contact lenses is a very important one if we have parents who are unsure, who are skeptical of the fact that their child could be a successful and safe contact lens wearer, when in fact all the evidence tells us that kids are likely to be our safest contact lens wearers and perhaps our most satisfied as well when it comes to vision and comfort. So this provides some key information on contact lens safety in kids, including statistics for the low risks of microbial keratitis or infection, which is in the middle of the bottom row there. It also talks about the benefits of contact lenses for kids in terms of improvements to their self-confidence and their ability to participate in activities, and that kids are generally quick to learn how to handle and how to care for their contact lenses as well. The final panel on this communication side is why myopia management is essential. Now, you might decide to start with this messaging, you might decide to conclude with it. It's completely up to you. You can obviously use these panels in any order. But the intent here is to articulate the short-term goals of myopia management, which is more stable vision between eye exams, and the long-term goals, which are reducing those lifelong risks of eye disease and vision impairment that we know are associated with increased levels of myopia. Underneath that long-term goal, we can see some statistics, just some simple figures there on the increased risks of pathologies with higher levels of myopia and the important information about 1 diopter. Each additional diopter increases the risk of myopic maculopathy, and each prevented 1 diopter reduces the risk of eye disease and vision impairment. Now, the second side, which is predominantly blue coloured, is a practitioner chairside reference designed for you to enable you to understand risk factors, what to prescribe with flowcharts, follow-up schedules for myopia management, and also gauging long-term success. The first of these panels is myopia risk factors, and this is a graphical summary you might want to potentially use with parents as well, that talks about the various risk factors, those which we can't modify, which is age of myopia onset and parental myopia, those which can be easily modified, being outdoor time and near work time, and those which we potentially can modify, which are binocular vision disorders associated with myopia development and progression. Now, this enables us a simple traffic light representation of risk. So it's something that can help us to understand the level of risk for that patient, as well as to potentially use in clinical communication. The second panel on your chairside reference side is what to prescribe. And this is essentially thinking about, firstly, contact lenses versus specs. A child with myopia needs either contact lenses or spectacles to see. So if we're picking a contact lens option or a spectacle lens option, what might our considerations be in terms of refraction and also binocular vision presentation? There's also some notes there on atropine and specific guidance to help you in making these prescribing decisions. Now, the follow-up schedules, which is the third panel of your chairside reference, is taken from the International Myopia Institute Clinical Management Guidelines. So these are just to enable you a quick reference for what follow-up should be, ideally with different myopia control treatments. And finally, an extremely useful panel is the Gauging Success panel. Now, I don't need to go into much detail with that because in our third lecture, we heard from Jeannie Saw, who went right into detail on understanding progression and success in myopia management, and specifically using this particular panel of the infographics to support you to make those judgments in practice. So this is an overview of all of the ways that myopiaprofile.com is designed to support you in your practice, from the point of view of learning as well as in clinical resources. We also have a variety of social media profiles that you can follow as well to stay right up to date with everything we release in terms of clinical articles, scientific research, and other innovations that occur in the field of myopia management. Now, I just wanted to show you here how to find a couple of clinical articles specific to using the infographics. So as I mentioned earlier, in the Knowledge Centre you have clinical articles, science articles, you have that myopia control product compendium as well. And if you have a look at the clinical articles, there are a variety of topics you can choose from depending on what you want to learn. So in this particular screenshot, we've clicked on clinical articles, and if you click on topics, you can see there are around 20 categories that we have organized all of the articles into. There's something like 500 plus articles on myopiaprofile.com now. So you're not going to read them all. You're going to read things that are specific to your topics of interest, and this enables you to find those. Now, these two articles in particular are designed to support you in using the Managing Myopia Guidelines infographics, which I've been describing thus far. So there's one article called Using the Managing Myopia Guidelines infographics, and also which myopia control treatment works best. And that gives you a little more perspective on the podium presentation of the treatments which are in the infographic to enable you to have those conversations and also to really understand that yourself as well. As I mentioned earlier, from the Resources tab of myopiaprofile.com, you can download the infographics entirely free, available in 20 languages. And also just under that picture of my bubblehead there, you can see a screenshot of the parent brochure. So this is designed to duplicate what you will have discussed within the infographic, the colourful patient communication side, and give them something to take home specific to your discussion. The little screenshot underneath that is the informed consent template form, and that's something that's hugely helpful to you if you're setting up specific messaging in your practice, whether that be information forms or information perhaps on your website as well. Now, I mentioned earlier the My Kids Vision QR code sheet. This is also downloadable from myopiaprofile.com. And My Kids Vision we have designed to support your clinical communication, to do a lot of the heavy lifting for you in explaining various elements of myopia management. So if you download this sheet and print it, or if you have it displayed on your computer, what that enables the parent to do is to point their phone at the QR codes and to open specific articles. You might want them to read specific articles on expectations in myopia control, or which treatment works best, or even why myopia control is important. And that particular sheet will make that a whole lot easier for you and save you time in clinical discussions. mykidsvision.org is designed to support your communication to parents and also to support their further learning as well. It's also something you can use to train and educate your practice team as well. And we have Facebook and Instagram profiles for My Kids Vision, which you are freely able to share. If you share those, that helps to demonstrate your interest and your expertise in pediatric eye care. Now, a really useful resource that we've established on mykidsvision.org is the risk assessment survey. This has been there right from the very start of when we launched this website, and it's gone through various improvements and iterations over time, but ultimately what it's designed to do is to educate parents on risk factors for myopia. So I'll quickly take you through the questions of this risk assessment. It's very simple. We ask, how old is the child? Is the child already myopic? When did the child first get glasses? Parental history of myopia. We ask about close work time aside from school hours. And then we also ask about outdoor time, including breaks at school. Once we have a look at those results, we have a really detailed algorithm which runs behind the scenes to grade genetic risks, so family history, their environmental risk, and their individual risk based on their age and current level of myopia. And then this directs parents to further reading on mykidsvision.org. So a lot of colleagues use this in their waiting room to begin the conversation, to begin parental education about myopia. This is something you could even potentially send to patients to complete before the eye exam. It's a really useful communication tool that also helps to shortcut and simplify some of those conversations, all that information you need to deliver in practice. So this brings us to the end of the foundation stream of the online seminar series, but I just want to tell you a little bit about everything that's happening across September for Myopia Action Month and what you can do to join in and be a part of it. Now, you've chosen to watch the foundation stream. We also have the advanced stream. You can watch them both if you wish to. They've both been released at the same time. We've also released 5 new Made Simple courses. These are all 1 hour in duration and intensely practical, and either approved for continuing education or the process is underway in a variety of countries. We have a special offer for the bundle of courses in September, which I'll tell you about in a moment. We also have the Myopia Management for the Practice Team certification course. This is available through a free practice account. I'll take you through each of these in turn. Now, an extra special bonus we have for Myopia Action Month is the free social media kit. So we'd suggest that you download these and you can post these in any order at any time across the month. We have 2 social media banners, Facebook and LinkedIn, and then 3 graphics, which you can customize with particular information to demonstrate that you're taking action in managing myopia. The online seminar series you're watching right now, you've watched the foundation stream. We also have the advanced stream. They'll be available on demand for you to watch throughout September, and honestly, we'll keep them up a bit beyond that as well to make sure you have the best chance to get all the information on board that you want to. I mentioned our online courses earlier and that we have very recently reorganized our courses into different streams. So we have our foundation stream, which is the Made Simple courses. They're all 1 hour courses and intensely practical in a very similar format to help you get up to speed on foundations and treatments in myopia management. We then have our advanced courses. Now these are 2 or 3 hours duration and they're delving deeper into a specific topic, whether that be communicating the myopia message, mastering refraction in kids. There's 5 courses that we have there within that advanced course stream. And then finally, we have 2 courses which provide comprehensive training. These are 6 hours in duration each, and these are designed to really get you started like a boot camp in ortho-K or in binocular vision diagnosis and management. Now, we have bundled these now, so these are all available at a discounted price as a bundle compared to individual course purchase. And so those bundles will endure after Myopia Action Month, but we have a special offer for you on the foundation courses across September. Now, our brand new Made Simple courses, as I mentioned, are all 1 hour extremely practical courses where we take all of the science and distill it into what you need to know about the evidence, getting started in practice, clinical communication, long-term care, and there's also case studies, interactive case studies in each of these courses. So we have 6 courses available now. The first one is free. We launched that last year, which is Myopia Management Made Simple. And now we have courses on visual environment, spectacles, soft contact lenses, atropine and ortho-K. And what we have is a special offer running across September that if you use the code MAM2024 at checkout, you'll get a bonus amount off the bundle. The bundle already saves you around 40% compared to individual course purchase. But with this extra discount, you'll save over 50% compared to individual course purchase. And that code is available for you to use on the foundation courses, the Made Simple courses, across September. And we also have our practice team certification course, and this is entirely free to access through a practice account, which is also free to establish. Now, what is a Myopia Profile practice account, you might be wondering? Currently, we have individual accounts, and an individual account you will use as an eye care professional to download resources and also to take courses, to have all of your completion certificates and potentially continuing education tracking within your individual account. A practice account is a group location account. It uses an admin email address and enables eye care practitioners as well as practice staff to utilize an account or to utilize a dashboard, which then directs to specific courses and resources available for practices. Now, even if you're not a practice owner or you're working in a corporate or a group practice, you don't have to own a practice to have a practice account. If you have a collaboration between the eye care professional side of the practice and practice team members, you can work together and make best use of this practice account. So have a look, it's free to set up and it enables your practice team colleagues to access that Myopia Management for the Practice Team free certification course. Now, none of this would be possible without our generous and visionary sponsors who have been there right from the very start and enabled us to build this enormous volume of resources, of knowledge and education to help you put this all into practice. And we wouldn't be able to run Myopia Action Month without them either. So enormous thanks to our sponsors, and hopefully you've also enjoyed the various product and practice insights that have been provided by our sponsors within this lecture stream as well. So we really want to urge you to stay involved in Myopia Action Month. You can do that however you wish. It's designed to really engage you wherever you are in your myopia management journey. And you can stay in touch through looking at the website, myopiaaction.com. That's very easily linked from myopiaprofile.com. Also, our social media profiles will be going wild throughout September, Facebook, LinkedIn and Instagram, and we'll also be sending you emails to make sure you're taking the best opportunities you can, making the most of Myopia Action Month. Thank you so much for listening. I really hope you've enjoyed the foundation stream of our online seminar series for Myopia Action Month 2024.